Fracture healing. The stability of the fracture decides what type of healing will occur. If there is a small amount of strain, like below 2%, the primary bone healing will occur, as the case when you use compression plate. If the strain is between 2% to 10%, then secondary bone healing will occur, such as when using a cast, a rod, or external fixture. In the primary bone healing, you need absolute stability. It's called Haversian remodeling or cutting cone remodeling. Sometimes it's called intramembranous healing. The secondary bone healing will occur when the fixation is not rigid, such as a cast, and there will be endochondral ossification.
Primary bone healing is seen when the fracture is reduced and held absolutely rigidly following internal fixation and fracture compression. Similar pattern of healing is seen in impacted fracture in cancellous bones. Two patterns of primary bone healing are observed. First one is the gap healing. New capillaries and osteoprogenitor cells growing in from the fracture edges fill the gap and new bone is laid down on the exposed surface. In case of very narrow gaps, directly lamellar bone is formed. For wider gaps, initially woven bone is formed, which is then remodeled to lamellar bone. The other type of primary bone healing is the contact healing. When the fracture surfaces are in intimate contact and held rigidly from the outset, internal bridging may occasionally occur without any intermediate stages. In primary healing, by 3 to 4 weeks, bone remodeling unit starts acting, which lay down organized lamellar bone to create a brand new Haversian system. Secondary bone healing is the natural form of healing in tubular bones. Under most circumstances, there is some movement at the fracture site and bone heals with a callus in 5 overlapping phases.
The stages are hematoma, inflammation, soft callus, hard callus, and remodeling. When the fracture occurs, there will be bleeding at the fracture site. It will make a fibrin blood clot. Then the stage of inflammation comes. The cells, the macrophages, the mesenchymal cells, the stem cells migrate to the fracture and form the granulation tissue and will release the growth factors. Granulation tissue tolerates the greatest strain before failure. Stage of soft callus. Soft callus occurs within 2 weeks. The amount of callus correlates with the immobilization. The stiffer the immobilization, the less amount of callus. Flexible fixation will result in endochondral ossification, abundant callus. Secondary bone healing, healing through cartilage formation. So the stability helps direct bone formation. Lack of stability helps the formation of cartilage, which later on can change to endochondral ossification. How does the endochondral bone formation occur? The chondrocytes proliferate, then hypertrophied, then you get matrix mineralization. The chondrocytes die, and then you get vascular invasion, ossification, and remodeling to lamellar bone. After the soft callus, you get hard callus. And the collagen changed from predominantly type 2 to be followed by type 1. 1 is bone, 2 is cartilage. After the hard callus, there is remodeling. The stage of remodeling will begin at 2 weeks and continue many years after the fracture has healed. The woven bone will be replaced by a stronger laminar bone, and the fracture healing will be complete with the continuation of the medullary canal or medullary cavity. The remodeling of bone is influenced by the Wolff's law, means the bone is affected by stress. You need to know all the stages of bone healing because sometimes it comes in the exam. You need to know the order of bone healing. Blood flow at the fracture site is very important for fracture healing. The blood will supply the fracture with nutrients and cells. Initially, there is decreased blood flow at the fracture site, which will increase later on, and the blood flow will peak at 2 weeks and return to normal after about 3 months.